Doctors of Reddit, what is a 1 in a million chance thing about your patient you have witnessed? Creutzfeldt-Jakob disease without relation to mad cow, the prevalence of which is about 1 in a million persons worldwide yearly. Edit. To everyone interested in this subject, I highly recommend The Family That Couldn't Sleep by D.T. Max. It starts out as an investigation into an Italian family with inherited fatal familial insomnia, FFI. This is a horrible prion disease that destroys the part of your brain that allows you to sleep. You die after 6 to 8 terrible months with complete loss of the ability to sleep, panic attacks, rapid onset dementia, and some weeks in a permanent limbo between waking and sleeping. The book also contains lots of information on scrapie, in sheep, kuru, in cultures that ritually eat their dead, and mad cow disease. It is very well written and understandable to people without medical education. During my residency, I worked in a unit which did a lot of urology. We had a series of regular patients with urethral strictures, narrowing of the urinary passage, and they used to visit from time to get their strictures dilated. These veterans would eventually learn how to catheterize themselves. One of the patients, a young boy of 14 whose original injury had been a pelvic fracture in a road traffic accident, came to the ER on a Saturday in considerable discomfort. I was on call and asked him what happened. I passed this catheter in and I can't get it out. What he was using wasn't really a conventional urinary catheter, which has a balloon at the tip to keep it in place, that can sometimes get stuck if the channel to deflate the balloon gets clogged. But that was not the problem here. He was using an infant feeding tube because the conventional catheters were too big for his narrow passage. The feeding tube is just a simple tube with no swellings and no mechanism to retain itself in the bladder, so I didn't really believe him. However, I found that he was right. I couldn't get the catheter out either. The catheter was fitting so snugly in the stricture that he couldn't pass urine, and his bladder had filled up like a balloon about to burst. We took him to the OR and did a suprapubic cystostomy, basically made an opening into the bladder from the abdomen. This relieved the pressure in the bladder. Next we passed a scope down the SPC and found that the feeding tube that he had used as a catheter had gone into the bladder and got knotted around itself. Every time we tugged on it, the knot was getting tighter. We had to cut it off below the knot to get the rest of the catheter out. We got the knot out from the SPC. Nurse. We give an antibiotic called Rocephin very frequently for patients diagnosed with a UTI. The only complication I've ever seen from it is vomiting if it's pushed too fast. I had a patient transferred to me from our urgent care side who had walked in fairly healthy, but complaining of UTI symptoms. They had tested his urine, diagnosed him with a UTI, given Rocephin, and were planning on discharging him home with oral antibiotics. We still don't know completely what happened, but this is our best guess. We think he had a gram-negative infection that reacted to the Rocephin by lysing. The bacteria essentially exploded and raced through his body, putting him into almost instant septic shock. He had to be intubated and put on blood pressure medications to keep his BP high enough to perfuse his organs. His temp went from 98.6 to 104 in under an hour. A central line was placed because we kept running out of IVs to give medications. He was transferred to an ICU. I have never before visited a patient of mine in the ICU, but because of his drastic decline, I had to see him and know how he was doing. I cleared it with the ICU charge and visited him 2 days later. He was extubated and walking almost on his own. One of the fastest declines and recoveries I've ever seen. Husband is a doctor, and one night came home with a surreal look on his face. He had been seeing a patient for a bit and noticed that although in his mid-20s, had few signs he went through puberty. The patient didn't mind his state all too much, but my husband believes that medicine should improve your life, not just keep it going. So, on a shot-in-the-dark hunch to simply improve a patient's life, my husband sent him for an MRI. The patient had a previously benign and now malignant brain tumor, suppressing the part of the brain that controls puberty. The shot-in-the-dark effort to see why the patient hadn't gone through puberty by late 20s led to a very early brain tumor detection. As a family doctor and still a resident, he couldn't believe how much a hunch made a difference one person's life. Edit. I showed him the outpouring of support this comment gave him, and, although very exhausted, he is extremely elated. Thank you everyone. I personally can tell it really gave him a confidence boost. Again, thank you. I was a paramedic and I came to a scene where I had a patient who was talking to me, but he had no blood pressure and no detectable pulse. I couldn't even hear his heartbeat with a high-quality stethoscope. They dumped a few bags of fluid on him in the ED before they were barely able to get a BP on him. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated, and it was distended. No drainage per catheter. When we pulled the catheter out, there it was, a worm which got stuck inside the tube. How the hell did the worm enter the bladder? Lab tech here. We see worms very often. Disgusting and interesting at the same time. Once when a female patient was submitting a urine sample, a full worm worked its way into the cup. It was Ascaris lumbricoides. Gotta love the medical field. Edit. So sorry that I ruined everyone's lives, the more you know. Thanks. I hate it. I'm a nurse, and this happened at the hospital I work at, in the car park. A staff member got out his car and it started rolling. He reached in to pull the handbrake. From where I was sitting in my car, I didn't notice anything other than the car move, and the guy jumped back in his car. A few minutes later, a lady walks by and starts screaming. Turns out he had been pinned half inside his car by his car door, as his car had rolled towards the car next to him. He was unconscious, blue, not breathing. A bunch of us tried breaking into the car next to him to move it, and eventually, when there was about 20 of us, we actually managed to push his car back enough for PPL to pull him out. Luckily this happened at a hospital, so the crash team had already been called. They did CPR. He lived. I'm a speech therapist, speech-language pathologist. I was a student when I saw a person who had fallen 30 feet through a disused factory roof. They had skull fractures, multiple strokes, multi-organ trauma and multiple spinal fractures, and had a tracheotomy. I was there to assess speech and review eating and drinking. Reading their notes, I imagined there would be serious issues. They were able to eat and drink with only slight texture modifications. They could speak using a speaking valve and had no aphasia, problems with understanding or finding words, or dysarthria, unclear speech. They seemed slightly amused and bored of my assessment, took my notebook and pen, and wrote "I can write too" in flawless handwriting and handed it back. I finished placement not long afterwards, but they were expected to make a full recovery. I'm not a doctor but an RN. Before I was an RN, I was a patient care technician in the emergency department. I often worked closely with a specific doctor. She had a habit of thinking that there was always more to symptoms than there were, so no one ever took her seriously when she went digging. She especially paid close attention to pediatric patients and ordered way more tests than any of the other ed physicians would have. There was a 12-year-old boy whose parents brought him in for suicidal and homicidal ideation. The child talked about how he hated himself, wanted to die, suddenly hated his parents and siblings, and often thought of hurting them. He had no history before this of being mentally ill, and it happened very suddenly. Within a week his personality changed. His parents were absolutely certain that it was just him being a preteen, hormonal and unstable. All the things he described were typical of a depressed and mentally disturbed preteen, and none of us thought anything otherwise. We assumed he was suffering from mental illness. However, when the doctor spoke to him, he vaguely mentioned having frequent headaches and getting dizzy a lot. He and his parents also talked about how he had started complaining of nausea and would sometimes vomit for no apparent reason. She thought that he may have something organic and not just mental going on. She got a CT on his brain. I remember the nurses saying she was overreacting and that the kid should just have a psych consult and be hospitalized. I very distinctly remember people complaining about doing more work than necessary on this child who was obviously just mentally disturbed. It turns out, the kid actually had an atypical teratoid rhabdoid tumor, ATRT, which is incredibly rare, less than 1% of childhood brain tumors. The tumor had been there long enough to spread to his frontal lobe. On further questioning after he was diagnosed with the ATRT, the child had been complaining of dizziness, vomiting and headaches long before the personality changes, but it was attributed to him being overweight and having ADHD. It's honestly amazing that the child lived long enough with this tumor for it to spread so far, as it's such an aggressive tumor, and generally, children don't live long with them, especially if they're growing at that rate. It's a rare brain tumor, and even more rare that a patient lives long enough for it to spread and cause personality changes. I will never forget that a doctor always looked further into things than people thought necessary. If any other doctor had been on that day, the kid would have been referred to psych, hospitalized in a psych institute and dead in weeks without his parents knowing it was all due to a tumor until after an autopsy. After a neuroconsult, he was shipped to Boston's Children for his brain surgery, one of the top places in the US for pediatric neurosurgeries, and he is alive to this day. He has to have therapies to help him learn how to live normally again, but if it weren't for that specific doctor being on, he'd be dead right now. Eventually, he will live a normal and long, healthy life. That really taught me to respect a doctor's knowledge more, especially if it seems like their intentions are good. Trust the physicians you work with and trust that they are ordering those extra tests not just to save their own asses, but because they want to save lives and are concerned about their patients. Was operating on a pregnant lady that came in having been shot in the belly. OB delivered the kid through our incision, and the baby had a perfect line across his shoulder, where the bullet had grazed him. He was totally fine and didn't need stitches. Mom lived too. Edit. Wow, thanks for the gold. Not rare, actually the opposite, but something we don't see too often. I had a patient with early stage pregnancy and some minor bleeding. I did ultrasound and saw a normal fetus but no heartbeat, and told her that it was likely due to pregnancy just being at an early stage. I checked her ovaries and told her that I could print a picture of the fetus. I moved the scan back to the fetus and there was a clear heartbeat. During the minute or so that I was scanning the ovaries, the heart started to beat. This was years ago. Saw a teenager, 16 or 17, have a heart attack. Jacked athletic kid with 8-pack abs fell on the ground clutching his chest during basketball practice. Everyone in the pediatric ER thought it was a panic attack, except for the adult ER resident who said, "I've seen hundreds of heart attacks. He's having a heart attack. Don't ask me why, but that's what this looks like." And that's what it was. He had an inborn anomaly where one of coronary arteries coursed between the pulmonary artery and the aorta. During exercise, the aorta and pulmonary artery expand with the increased cardiac output, and for whatever reason, that was the day that they squeezed a right coronary artery and caused a massive myocardial infarction. It was bad news bears. The damage was so bad, kid needed a heart transplant. He was transferred to a pediatric heart center. A left ventricular assist device, LVAD, was implanted because his heart function was so poor. A donor heart was found, and as he was being prepared for surgery, his own heart decided to suddenly start working again. It turns out that hearts can heal after a massive heart attack, especially teenage hearts and athletic kids. This was only discovered after the advent of the LVAD, because prior to that, nobody would live long enough to recover. At the time, I think this kid was like one of the first 10 pediatric patients to get an LVAD at that hospital. So the kid had to get his coronary artery re-implanted so that it wasn't going to get squeezed like that again, but he got to keep his heart, and I hear he recovered and returned to playing basketball. Obligatory, I'm not a doctor, but a coworker's son was born with hypoxic ischemic encephalopathy. Basically the valve controlling blood flow to and from his mother while in utero failed, and he was born with 30% of the blood volume you're supposed to have. The EEG came back showing massive anomalies. Little dude wasn't quite at the threshold of brain death, but coworker and his wife were told in no uncertain terms that he would never live off a ventilator, and it was pretty unlikely he'd ever open his eyes. The hospital persisted with treatment, though, and brought in a trauma team who worked on him for nearly a week, before 3 more weeks in the NICU, trying to control the seizures and prop up his organ function. Fast forward to yesterday, when the little dude made an appearance at a house party we threw. He's almost 2, and his neurotypical guy walked up our treacherous back staircase by himself and was talking up a storm in a language no one knows. He was a big fan of our cat. His entire drama team came to his first birthday party because none of them would believe it without seeing it. His entire brain basically regenerated and rewired itself after he was on the verge of brain death. It's the most unbelievable thing I've ever seen. Guy basically won the Powerball a couple of times in the first 2 weeks of his life.